My name's Eric Sletland. I'm the Vice President of Business Development Client Service here in the Woodbridge office in New Jersey. And I think the reason I nominated Joe, he immediately came to mind when you sent out the email, is because I've always admired his quiet competence. There's no fanfare or drama with Joe. He just gets the job done. And I don't think that was ever more evident than when the COVID pandemic hit. And if you recall, it hit here in the Northeast first. And when it first hit, there was a lot of uncertainty about the virus in terms of how you could get it. Joe heads up our healthcare sector. And he's built our relationships with the hospital systems here in New Jersey just by his simple integrity, doing what he says he's going to do, going the extra mile, understanding that we're a service company that just happens to be in the construction business. The other thing about Joe is that he's an individual that leads by example. So there was nothing that he would ask his team to do that he wasn't 100% prepared to do himself.
Joe MacInnes, project executive and healthcare leader in New Jersey out of the Woodbridge office. In New Jersey, when the pandemic hit early February, March, our team, short answer, we responded to whatever our hospital systems needed, wherever they needed and however they needed it is the short answer. That work entailed multiple things, starting with PPE. We provided Tyvek suits, foot booties, gloves, masks, and multiple other PPE items as fast as we could and whenever we could. We also coordinated window removals in the hospital. I want to say probably over 350 windows in patient rooms. We removed and installed insulated metal panels. So at any quick pinch, the hospital can, with their staff, can set up these negative air machines to create negative patient rooms for COVID or even suspected COVID positive patients. At 3 different hospital locations was actually patient room doors in vision kits, glass vision kits, so the nurses, checking on patients to not have to go into the room every time to help preserve some of that PPE shortages that occurred early in the pandemic. And all these efforts, it could not have been possible, without the New Jersey healthcare team performing, any task, anytime, any phone call we got. As crazy as it was in the beginning and things changing rapidly, our team really stepped up